Hello, good afternoon. My name is Alisa Pascale. I am a women's health nurse practitioner at Mass General Hospital. I want to take this opportunity to thank the conference organizer, in particular my mentor Jan Schiff, for inviting me to speak today. I'm going to be speaking about vaginal dryness and painful sex around menopause, in the perimenopause and postmenopause. And maybe I'm overpromising by saying that I'm going to answer everything you need to know about this topic, but at least I hope to give you tools and information that you can use to speak to your own healthcare providers or do your own research going forward. So without further ado, let's get started. I think one of the most important questions that people have is, am I alone? And you are not alone. At least half of women experience vulvovaginal symptoms at midlife and beyond. These can start before the periods actually have stopped, or can start years after menopause has occurred. And while sex and sexuality remain really important to the majority of women in studies, studies also show that rates of sexual dysfunction, or at least how women rate their sexual function, increase. So people are less happy with their sexual function as they get older for multiple factors, not just hormonal, not just dryness or pain, but for other reasons as well as we age. But this remains an area that women are very interested in addressing. So what's in a name? So specialists in the area of menopause came up with this name called the genitourinary syndrome of menopause to describe a variety of symptoms that are related to physiologic changes in the genitourinary tract. So that refers to the bladder, the opening to the bladder, which is called the urethra, the vagina inside, and the vulvar tissues outside, and the genital area. These all have many estrogen receptors. And as we age and estrogen levels decline, changes in these tissues can occur, which cause symptoms for many folks. So this is a nice table from some authors that outline the genital symptoms like itching, burning, irritation, pain or pressure that people might experience, the sexual function, dryness, loss of arousal, libido, things like that people might experience, as well as urinary symptoms, burning with urination, urgency to go, feeling like you're having UTI when you aren't, or having more urinary tract infections. All of these symptoms can occur as estrogen levels decline in menopause. So this term, genitourinary syndrome of menopause, doesn't exactly roll off your tongue. We abbreviate it as GSM, but it is really under-recognized and undertreated. And this is because many women don't feel comfortable talking about their symptoms, or they think they just have to live with them as they get older. And frankly, many healthcare providers don't really ask about the symptoms. And so if it's not being brought up, people just continue to manage the symptoms on their own. But as you could see from the table I showed you on the last slide, these symptoms can have a significant impact on quality of life, on sexual functioning, and overall health. The diagnosis is made clinically. There's not any hormonal test per se, although, as we'll talk later, there are other conditions that can be similar to these symptoms, and so other things may need to be ruled out. But the great news is that we have treatment options. So what can we do about this? Well, we can treat, or women can elect to treat themselves really with over-the-counter non-hormonal treatments. These are things like lubricants, which reduce friction, vaginal moisturizers, which are inserted into the vagina using some kind of an applicator, products that have hyaluronic acid, for example, sort of adhere to the vaginal walls and release moisture over the period of hours or days. So most of these vaginal moisturizer products are intended to be used maybe twice weekly or 3 times weekly. And for many people, these sorts of over-the-counter products provide relief. This is not intended to be an exclusive list, but here are some vaginal moisturizers, again, non-hormonal, no prescription needed, that people find helpful. So these are a couple brands that I mentioned here, and then also some people simply use coconut or olive oil, Crisco, things that are neutral that you don't react to can also be used, and for some people provide adequate support for dryness. Personal lubricants are available as well over the counter. Again, I'm not intending this to be an exclusive list. I don't have stock in any of these companies. But interestingly enough, the World Health Organization put out some recommendations for what a personal lubricant should, sort of for qualities of a personal lubricant that would be safe and helpful in the vagina. And actually, there are many products on the market that do not meet these criteria. It's hard to find the criteria on the product websites. So I did try to research at least some. Some of the products that I had researched that met the criteria are listed here. And so are available to you online or over the counter. So turning then to prescription hormonal treatment. So if vaginal moisturizer is not enough, if personal lubricants are not enough, often we discuss and offer folks hormonal treatments. These are local low-dose products with primarily estradiol or estrogen that comes in either a cream, a tablet, or a ring form. So the tablet or the cream is inserted in the vagina twice weekly. The ring, it goes in the vagina and stays in for 3 months at a time, sort of similar if any of you used diaphragms or saw diaphragms in your younger years. It looks a little bit like a diaphragm without the middle, and releases very low levels of hormone that way. These are available through your healthcare provider with a prescription. There's also one product that is oral. So this is an oral product that has targets the estrogen receptors in the genitourinary tract to treat dryness. So for people who really don't like to use vaginal products or don't like the discharge or whatever, this oral option is available. And then there's also a progesterone, a vaginal DHEA product. This is a precursor to other hormones like estrogen that is used vaginally as well. Generally, we don't recommend systemic hormone therapy, estrogen, progesterone, systemically to treat vaginal dryness alone. And while laser and radiofrequency treatments are often touted as helpful, and in fact, may be helpful for some people, they're not very cost effective and probably not that much more effective really than using the products that I've listed here, the estrogen, the progesterone, and so forth. So for the cost out of pocket, you may get the same benefit from these other products that are available through your insurance company, hopefully in most cases. So here is again a table listing vaginal creams, vaginal inserts, rings, oral tablet with instructions for how it's used, just there as a reference. This comes from the North American Menopause, now called the Menopause Society. And these are the products approved, FDA approved in the US for this condition. So the next question that I get all the time is it really safe? And in fact, one of the challenges that we run into is that vaginal estrogen products carry the same warnings as oral birth control pills and systemic estrogen therapy, which scares people. So often in a quick visit with your provider, they'll say, here, try some vaginal estrogen. And then you go home and read the warnings about breast cancer and stroke and heart attack. And you think, oh my God, I don't want to use this. This is really scary. But in fact, several very large studies have shown that there is really no increased risk of heart disease, stroke, or breast cancer in women using local low-dose vaginal estrogen products, the kinds I'm talking about today. The theoretical risk of blood clots is extremely low, given the way that it's absorbed through the vagina and the very low dose of, or little to no, virtually no systemic absorption from this product. So even people who may have a risk of blood clots may be good candidates to use vaginal, again, local low-dose vaginal estrogen. You do not need to be given progesterone to address the vaginal estrogen products. And as I said, again, the warnings are the same on the package insert, but really the risks are quite different. And there is a movement that's been going on for some time to try to relabel these products because, again, people get nervous when they understandably read the fine print. But there are some reasons that maybe you shouldn't use local vaginal estrogen. Very important, any undiagnosed vaginal or uterine bleeding. Now, some women after menopause with their dryness develop vaginal bleeding, and ultimately the estrogen will treat that, which is great. But we have to rule out that the bleeding is not from some other cause. So you definitely want to talk to your provider about any vaginal bleeding that you're having. Estrogen-dependent cancers, uterine cancer that isn't treated, for example, or breast cancer may be a reason not to use local vaginal estrogen. However, breast cancer is not always a reason not to use it. And many of the oncologists here at Mass General, where I work, are comfortable with their patients using very low dose local vaginal estrogen products, the ones I've been talking about, particularly if they've already tried other things that we also talked about and they're not helpful. So this is not an absolute reason that you can't use estrogen. Of course, individual choice is an important factor here, and some people really don't feel comfortable, but it certainly is something that could be considered, something you could talk about with your healthcare provider and with your oncologist to get their input as well. So then people ask me, in some cases, I've tried everything that you've told me about, Alisa. What is next? Nothing is working. What can I do? So I like to give a little quick overview here of other sources of dryness and or painful sex beyond the GSM condition that we just talked about. And I sort of have this very unscientific bucket way of organizing. So the first bucket here that you see is green are things that occur on the outside of the vulva. These are skin conditions that can make you dry, itchy, irritated, or have skin tearing, things like that. Things in the vagina, GSM we've talked about, but also yeast, vaginitis, things like that. GSM, again, kind of goes between these two, right? The vulva and the vagina. We talked about that, as well as the bladder. For sexually active older adults, we do have to be thinking about sexually transmitted infection. So that's something to keep in the back of your mind if you're in that risk, if you have a new partner or partners. Pelvic floor can cause symptoms like pressure or bulging. Organ prolapse, cystoceles, rectoceles, things that affect that in terms of the support of the pelvic structures can cause symptoms. And then you can get pain from nerve causes. Vulvodynia, I'll talk about just briefly at the end, but pudendal nerve issues, people that have had hip issues or low back issues can sometimes have pain that radiates to the vulva. So we kind of generally call this area pelvic floor dysfunction, where the pelvic floor muscles themselves or the nerve endings that travel into the pelvic floor are in some way compromised and causing symptoms for folks. So going back to kind of give you just a really quick overview of those four buckets, again, vaginitis occurs in women as they get older. You can still get a yeast infection. You can still get bacterial vaginosis, however, with the caveat that a lot of times menopause alters the microbiome in the vagina, not always. And so sometimes people are sort of overtreated for vaginitis when the real underlying culprit is the lack of estrogen that we've talked about earlier. So often we'll treat with the estrogen first and then reevaluate for any kind of bacterial infection. And then there's a rare, less common kind of condition, which is an inflammatory vaginitis, which presents usually with very large levels of discharge and irritation, which can be evaluated by a local gynecologist. The next thing, we talked about skin conditions that can affect or cause vulvovaginal symptoms. Contact dermatitis is huge. People are spending a lot of money on vaginal feminine hygiene products. This little picture I took at the drugstore is like 1/20th of the wall of things, products that are out there for our genitourinary health available at, any of our pharmacies. And these have a lot of ingredients and people are allergic to them. So, generally less is more. I tell people, use free and clear soaps, free and clear laundry detergents. Be really careful with what you're putting there, because sometimes the thing you're putting to treat the symptoms is actually contributing to the symptoms. There's also a condition called Lichen sclerosus, and this is about 1% of women experience this. This is a very itchy dermatitis on the external vulva that causes a sort of tissue paper whitening that I've shown here. This is a condition that really does occur most often in menopause and can cause symptoms. So again, if you're having symptoms and they're not responding to the treatments you've been given or tried, somebody needs to take a look and make sure that they've ruled out all things, including lichen sclerosus. When I showed you my buckets, I mentioned pelvic floor dysfunction. This is a drawing from Elizabeth Stewart's The V-Book that shows a lot of muscles that support the opening to the urethra, the bladder opening, the vagina opening, and the rectum, where the bowel passes. And dysfunction in this area, in the hip, in the low back, in the spine, can contribute to pain, particularly pain with intercourse. And so this is something we think about in folks who are not getting better. Being evaluated by your gynecologist or a specialty called urogynecology can be quite helpful. We do have in Boston, wonderful specialized pelvic floor physical therapists. So these are trained physical therapists who specialize in pelvic floor issues, things like incontinence, painful intercourse, bowel problems, who work with a variety of issues to help specifically target those pelvic floor muscles. So this is an important resource that, again, excuse me, your healthcare provider should be able to help link you with. These pelvic floor physical therapists might give you some stretching, strengthening, or talk about biofeedback, myofascial release, dilator work, dilator use, and things like that. And then finally, that last bucket that I referred to was neurological kinds of things. So pain conditions that can affect the vulva. Vulvodynia is the general term, but it can be subdivided into where the pain occurs, when it occurs. And so this table sort of outlines the diagnosis of vulvar pain. But any vulvar pain of more than 3 months that doesn't have an explanation, maybe vulvodynia, again, should be evaluated by your healthcare providers. So to conclude today, I want to say that you shouldn't be afraid to ask about these symptoms. If you're experiencing vaginal dryness or painful intercourse in the perimenopause or postmenopause, or really any time in your life, feel free to ask your providers. Not all providers are going to be comfortable discussing this. You may need to make an appointment specifically to talk about this one issue. If you've covered a lot of other issues in your visit, they may not have time to spend with you, but again, ask about it. There are definitely treatment options. And I think it's really important to stress that these can be individualized. I think the most satisfying conversations that I have with my patients in an exam room are really individualized treatments for what they prefer. So some people come in and they really want to try hormones. You know, their friends on Instagram are using it, or they've read something online. The New York Times has had some great media about menopause recently. So people come in very interested in hormones or not interested at all in hormones due to their personal history, their family history, or just that they're sort of more of a less is more kind of person and don't want to use hormones. Having said that, there are lots of treatment options, and these can be individualized to you. I think the other bullet I don't have here is that sexual dysfunction, as I mentioned in my early slides, can increase as we get older for a variety of reasons. And if you've been addressing the dryness and the lubricant issues and you're still having issues, there are some resources here in my final slide that can help you find sex therapists or sex educators or other kinds of resources regarding sexual health as you age. That in itself could be, of course, the whole talk. I did provide a link to the Menopause Society. This was previously called the North American Menopause Society. They recently renamed themselves to the Menopause Society. They're a fabulous resource. They have lots of information for patients and for providers. These are some books that are quite current, that talk a lot about these conditions and many others related to menopause. And as I mentioned, again, the resources here for sex therapists. I do provide some more medical resources here at the very end if anybody's interested in looking at some of the literature. So I think that concludes my talk today about dryness and pain with intercourse. Of course, you'll have an opportunity for some questions later. It was, again, a great pleasure to come and talk to you today, and I wish you all the best. Take care.